There are sort of three areas classically associated with burnout, and those would be emotional exhaustion, I just can't do this anymore, depersonalization, which is a sort of cynicism, separating the full self from the work task, just sort of coming in, checking at the clock and checking out, rather than fully engaging in the opportunities and challenges of the workplace. And finally, a low sense of personal accomplishment. I don't get enjoyment and fulfillment out of my job task or job role anymore. Those are the three classic areas of burnout and sort of the telltale signs. In terms of what places clinicians at most risk, again, most clinicians list administrative tasks at the top of the stack in terms of what drives them to experience burnout. In terms of work-life balance, if there are problems at work, that's bad. If there are problems at home, that's bad. But if there's a conflict between the work and home, where my work problems are bleeding over into my home life, or my home life problems are bleeding over into the workspace, those are the worst combinations and can place clinicians at highest risk of burnout. Raise your hand and ask for help. Talk to a trusted mentor or colleague. Talk to administrative supervisors or other members of the team to say, hey, I think I need to take a step back and understand how I can regain job satisfaction, regain a sense of personal accomplishment, recharge the battery, so to speak. Sometimes paradoxically we think, oh, I can't do that because the team needs me, or the patients need me, or the hospital needs me, or the clinic needs me. In fact, that's just the opposite of what we should do, because again, a clinician who's not well is a clinician who's not performing well, not only for the team, but for the patients or clients that they're serving. I think we are learning to pay much more attention to it. And I'd like to say that that's all for philosophic and altruistic reasons, but in actual point of fact, there's some very important managerial reasons why healthcare systems should address burnout proactively, and then once it's recognized, be very aggressive, if you'll pardon that adjective, in pursuing help for folks who are experiencing burnout. As it turns out, turnover is rife in the medical profession, and turnover is very expensive. It actually costs the healthcare system about twice an annual salary to replace a clinician. So actually investing in the healthcare professionals that we already have on board is a much better financial strategy than burning through clinicians every few years and replacing them. So just for financial reasons alone, healthcare systems have to be very attentive to burnout. Also, it does affect the bottom line in other ways. As we've already mentioned, it affects patient outcomes, satisfaction, prescriptions, tests that are ordered, and even medical legal risks. So it's very important that we invest in the healthcare clinicians that we have.